Hi guys, the Tories have been using whatever tools they can to convince the public that they just can't afford to pay nurses or other NHS staff more. If you of course ignore the tens of billions wasted on corruption, dodgy PPE, a test and trace system that wasn't fit for purpose, you still have government ministers saying, sorry, we just don't have the cash. The newest lie is to inflate the figures. Inflation at the moment is over 10%, but it is predicted to fall to about half that next year. Yes, it will be high, but it should be in the mid-single figures. Now, the Tories are presenting, when it comes to how much a pay rise would be, that inflation will be 10% next year, which is just plain false. Have a listen.
How have you worked out that it would cost every household £1,000 a year to give public sector workers an inflation matching pay rise?
So we have taken the level of inflation, which is currently about 10-11%, and we have projected that forward for next year because that's what you'd expect it to apply to, and that would give £1,000 for every family if we match that for the public sector.
Well, we've had a look at your numbers, as you'd expect, and we've asked the Treasury also how they worked it out. Now, your figures have used the inflation figure of 11%, which is just for 1 month. The OBR actually projects that next year inflation will be far less than that. Not to speak of it, when you're normally working about pay negotiations, you cut an average of inflation, not just 1 month, which is what you have done. So it's not £28 billion, is it?
Well, the requests from the striking unions across the board is generally about CPI. And the CPI level of inflation is currently between 10 and 11%. And actually, if you look in the case of nurses, they want RPI plus 5%. Actually, that gives you 19%. So you could actually argue that we're underestimating the number.
Well, you think it might be more than that. If that's the case, then why have the independent number crunchers, the Institute for Fiscal Studies, come up with a figure of £14 billion as being the cost of doing this?
Well, you'd have to ask the IFS how they justify their numbers. But what I can tell you is our number is justified on the basis of taking the inflation number, which is what the unions are asking for, and projecting it forward to next year. That would give you a cost of about £28 billion, and that's £1,000 per household.
But your inflation numbers that you're using are actually inaccurate and out of date. If you're talking about next year's pay settlement, nobody expects inflation. The OBR, who are independent, don't expect inflation to be anything like that next year. And this, for nurses and other public sector workers watching, this is about this year's pay deal. So if you want to be honest with people this morning, your numbers are not completely accurate, are they?
No, they're not completely accurate. They're completely inaccurate. But that's part of the plan. That's part of it, of the motivation behind this, to present false figures. Because he wants to convince the public that, look, this is going to cost £28 billion. We don't have the money. When in reality, it would cost half that. This is part of the political game the Tories are playing, trying to convince the public that public sector workers aren't worth it. NHS staff are not worth it. The private sector is the one doing the whole heavy lifting. They're contributing to society, contributing to the exchequer, but the public sector is just a waste. This is part of the Tory ideology. That's why so many of them are convinced that it would be a good idea to reduce the size of the state, offload services onto the private sector. Privatization. That's what they want to do, especially when it comes to the NHS. But they want to apply it to other public services as well. The dishonesty here, and it's great that Laura Kuenssberg is calling this out, but the fact that they're trying to present the trade unions as being greedy is pathetic and disgusting. But this is what you have to sort of expect now at this stage from the Conservative Party and this government. They don't care about public sector workers. They don't care about ordinary people. It's about reducing the size of the state, offloading as much as possible onto the private sector so they can make a profit out of this and funnel money from the taxpayer into the private sector, like in private schools or in certain parts of the NHS at the moment. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.